Hey everybody, welcome to the info session for the Graduate Certificate Healthcare Innovation. My name is Allison Schumacher. I am Director of Academic Alchemy for the VCU da Vinci Center and co-director for this program. And I'm here with Dr. Ingrid Pretzer-Aboff, who is the co-director as well. And we're here to talk to you a little bit about this program, how it might be able to complement a graduate or professional program you're already in, might be a good next step after you've completed an undergrad or a master's program. Really just for anyone who is excited about potentially developing products or solutions in the healthcare space. Ingrid, why don't you go ahead and introduce yourself and tell us a little bit about your experience in developing
Will do. Thank you, Allison. I'm associate professor in the School of Nursing, and I got involved in this project, their certificate program with Allison a little bit ago. We both co-direct, but we come from different angles, coming from the healthcare side. Allison is coming from the innovative side and how to get things actually produced or commercialized and get things done in that perspective. So I do own part of a company. I have a product, a couple of IPs and patents in place. And would like to get those commercialized. I didn't realize how long it would take. And I have met, without this program or a certificate like this, I have met pretty much every boulder or blockage you can meet. So I've learned from experience. So I wish this certificate program was alive and well and moving on when I was going through this. Needless to say, I do have a lot of experience in medical devices and getting them produced. So I develop and I test innovations, interventions, and ideas and processes for people with Parkinson's disease. And the goal is to help them walk easier and to enjoy life a little more and increase and improve their quality of life and keep them as independent as possible. So those devices that help really do go through, as a medical device, may go through the FDA process, CMS process, and all these other processes that I didn't know existed when I started on this journey until I came to VCU and met Allison, and now we're best buds and I keep asking her all these questions. But it's really been very, very fruitful and very helpful. On the flip side of that, what we bring, or I bring to the table, is the healthcare piece of it, of understanding what patient needs are and where our pain points are, and where we could use some help. So innovation and people that invent things and want to do that in the healthcare field, this really is a perfect match of getting us all together. So if you have any questions about healthcare issues, I am there for you.
And that's a great description, really great introduction into what we're going to be talking about today. You know, this is a 12-credit graduate certificate, so it's not a full degree program in product innovation like you might find in the Master of Product Innovation in Da Vinci, and it's not a full, nursing leadership and science degree that you would find in the School of Nursing. It's meant to kind of bring these two groups of people and these thought processes together to give a basic understanding of what it means to be maybe a biomedical engineer, an MBA, or just someone who gets excited and wants to help people by developing products in healthcare, whether that's helping care providers or helping patients or both, align with what we're getting out of the healthcare side. So having healthcare innovation people or healthcare people who are on the front lines every day, see problems every single day, and most likely had lots of ideas for different types of products, but don't know the process to actually carry that forward and prototype and test and actually move it into maybe a viable option for a business or a licensable technology later on. So we're trying to find a good, I guess, mix, a good place for these different types of mindsets to come together. So in the event you are a healthcare provider or want to develop a product like Ingrid has, or whether you're coming from the outside, want to develop products, but maybe you need to know some about compliance and how you get products adopted into a healthcare system, and safety and regulations and all of those kinds of things that maybe don't sound so exciting, but man, they can really do amazing things to understand how a product needs to be developed over time and who to go after when you need to start interviewing your users, right? You're very user-centric on the healthcare front. We are very user-centric on the product innovation side of things. We want to make sure that we're solving problems that humans actually experience.
And that is very key, is that need piece. I've had people come to me with a device that they've made for Parkinson's patient years ago, so you'll never figure out who it is. They brought me a device and said, can you try this? It was meant to remind people with Parkinson's to exercise, which is a key component of treatment. And so I said, okay. So I brought it to my Parkinson's friends and they tried to go, I'm just going to turn that off anyway. Nags like my wife. So the need for something like that really needs to be investigated before you go through the process, rather long process of inventing different things. It's never done
often, right?
Yeah, it's never done in isolation. You need both sides, knowledge of both sides.
Yeah. Well, I think that historically the issue is that it has been done in isolation. And then people are very confused when they're not taken up by the patient or by care providers in a health system, those kinds of things. So we're here to shorten that time period. We're here to help you kind of figure out where you want to go and what you want to do with the certificate. We like to meet people where they are and then help advance them beyond that. So I'm going to go ahead and share screen and we'll get to the meat of all of the things. So if you're interested in this gets you excited. Ingrid and I's contact information is at the end of this presentation, and we more than welcome you to reach out to us. We can have one-on-one mentor sessions or just kind of understanding where you are, figure out if the certificate's the right place for you to be. And if there's a lot that we can do to be able to help you along your path. So let me go ahead and share my screen here. All right, can you see my healthcare innovation slides, Ingrid?
Yes.
Thank you. Excellent. All right, so let's go ahead and flip through some things here. All right, so looking at resources for the Da Vinci Center. So, not just the Da Vinci Center, but also the School of Nursing, specifically this certificate program. So we'd like to be able to create a community. We want our students who are fully online and our in-person students and really all of our alumni to be able to come together over time and be able to work together, network, get to know each other, which can be kind of a difficult thing to do when you have people in multiple states or different locations. But we're really working on those new processes to be able to do this. This just launched in fall of 2020. And so we are still building it up and figuring out how can we provide something with real value to all of the students who are coming in, beyond the amazing people that you might meet in your faculty or the things you might learn in your classes. How do we deepen that? How do we expand beyond that? So we have started doing some networking events, some speaker events where we will be inviting students who belong into this program to meet each other over time, most likely via Zoom, just because we do have people who are fully online, so they don't actually live here in Richmond. And with the alumni of this program. And so you can meet people who are out running medical startups, who are already developing medical products in real life, care providers who have, much like Ingrid, identified a need and have worked towards a product, be able to share their story. What problems did they have? What did they learn over time? So hopefully you don't have to make the same mistakes and you can win based on their successes over time. So through this, we do have a speaker series, we do have networking opportunities. That we also have an online platform. I'm not certain if you're familiar with Miro, but Miro is this great collaborative space. It's kind of a wide open space and you can add all kinds of things to it. You can even use it for product development. But any student who's a part of this program is added to our Miro board team and is given access to a whole bunch of resources that we have on campus. Anything that you could possibly need for the certificate, ways to introduce yourself and talk about your specialties or your interests to other people who are part of the certificate. And just a lot of opportunities to read about product and what it means to develop product and user-centric research and all kinds of things. On top of that, all students at VCU now are given free Adobe Creative Suite. That used to be something that's very specific, but as long as you're enrolled in a class, it's no longer specific to a program. As long as you're enrolled at a class through VCU, you have access to the Adobe Creative Suite for free. We are officially an Adobe campus, which is very exciting. So let's see. There's also a couple links down here. This presentation will go out with this recording, and those are live links to the School of Nursing's events and the Langston Innovation Center, as well as for the Da Vinci Center. And I will say too, if you go to our events page, you should be able to sign up for our newsletter that goes out weekly and has all kinds of places for people to network, find jobs around innovation. And that's a very broad term when we talk about innovation, but all the things that are going on in Da Vinci and in our ecosystem. So exciting stuff. So if you want to engage early, want to meet our alumni, want to have those conversations before you can apply, by all means, reach out, join us at some events. All right. Next one. Looking at spaces and tools we have at the Da Vinci Center. We have a lot in between the two different schools. I should preface this by saying the School of Nursing courses are fully online and asynchronous. And so you don't ever have to go to the School of Nursing, but there are spaces available for you if you would like to go there, potentially meet up with teammates who are in your classes, because even though they're asynchronous, you're still working on teams. And after a couple of years of being in a virtual environment, we might be ready to have some in-person meetings. But looking at this slide, we have the 807 prototyping space. We call it 807 because that's its address, 807 South Cathedral Place. And we have lots of tools, materials, various things for students that are in this program to use. We have, I think, 5 different 3D printers. We have laser cutters, 3D scanners, crickets to be able to cut all kinds of different materials, fabric and vinyl, hand tools. You can see a bunch of those hanging up on the wall in that picture. All kinds of things, but all of that is just free and open for students to use. There is no pay to play kind of situation going on there. We just want to continue to help support students to be able to prototype or prototype and test whatever it is that they are thinking of. And that's not just physical prototyping. There's also there's lots of computer programs for 3D modeling, for data collection and those kinds of things in the computer lab in that space as well. The next one we're calling VCU Innovate, but that's where the Da Vinci in-person courses are held, is in VCU Innovate at 1010 West Gray Street. But I think the coolest part about that building is really the Shift Retail Lab. So this is a storefront that we opened right across from the Siegel Center on VCU's campus with the intent of it being a STEM lab, but for innovation and entrepreneurship. So if you have a product idea, and you want to get it in front of people to be able to get feedback, whether it's just the idea and you have some sketches, or you have a physical prototype that you want people to play with and give feedback on, we have lots of events to be able to do that. You can, if you have a product that you already create and want to sell, you can do that in this space and you maintain 100% of the funds that you earn through that. This whole thing is just really meant to help people test products and to understand whether or not their ideas are viable to either become a business or to become intellectual property, to be licensed and all kinds of things. It's a place to meet people from our ecosystem, venture capitalists if you need funding, talking to other students who are coming from different backgrounds but can share some really interesting thoughts on your product development process and what they've experienced in the past, share some of that knowledge. So Shift is the second one over from the left there. That picture is from before we opened last November. It's hopping now and those shelves are full with all kinds of things. And then the third from the left is the Innovate space, kind of a standard classroom. And the last picture there is coming from a communal space that is offered at the School of Nursing. A really nice place to just kind of hang out with groups, be able to do homework, lots of different collaborative environments that you are able to connect on. Yeah. All right, Ingrid, you want to take this one?
You need to switch it. Yes,
I did.
Here are the deadlines that we have. The next deadline, if you're interested in joining the spring semester, would be November 1st, and classes start in January. And then the summer and the fall deadlines are there as well. We have rolling admissions. Submission. We are rolling admissions. So if you catch one or the other, whenever you fill out the application, if you have questions, you can contact us. Next slide. It's a part-time program. There we go. It's a part-time program. It could take 1 to 2 years to complete if you're really on the ball and you have time. 2 courses a semester will complete you within the year. So nursing courses are offered online and they are asynchronous, but don't make the mistake of thinking that you could just take it as you go. We do have a lot of interactive pieces to it, and it's quite rigorous. Da Vinci will offer online courses, and they have been since last year, or is it this year?
This fall, we were
This
offering
fall.
our first fully
Okay.
online courses. Yep.
And that's great. So students may complete their program fully online if they want to. So if you're listening and you're out of state, this is an option for you. There are Da Vinci courses that are scheduled after 5 o'clock. Those would be face-to-face, and that would accommodate the working person. The spring deadline is November 1st, as I said. You apply through the VCU Graduate School. It is a 12-credit graduate certificate, so minimum you need to take the 12 credits. 6 of those credits are from School of Nursing Leadership Program. 6 of those credits are from the Da Vinci Center Master of Product Innovation Program. Some select Da Vinci courses may not be offered online, so you'll have to be careful with those. Next one.
If you have questions about which classes will be offered in the future, like right now, I'm writing the spring schedule for Da Vinci. So if anyone out here has questions on which classes will be offered fully online or which may be offered in a hybrid format, something like that, feel free to reach out to me at any time. If I don't know, I can get the answer for you relatively quickly. It's just if we don't have enough students to reach full enrollment for an online class and we have people in town who can take it in person, we might make that negotiation. But we are happy to accommodate. Just let us know. Yeah, just let us know what your needs are. All right. There you go.
So the requirements at a glance is you need a bachelor's degree from an accredited college or university. The GPA we have listed as 3.0 or higher on a 4.0 scale, but we do make exceptions. It's really we have a holistic review process, and we look at the individual as a whole, so it includes your experiences. So everybody's reviewed as individually. The GREs, the GMATs, the MCATs are not required for this program. And for those of you that are non-native English speakers and you've not previously been awarded an undergraduate degree taught in English from a university in the United States or a college, will provide evidence. You need to provide evidence for proficiency in English, and that could be through the TOEFL. You need 100 or higher, or IELTS. You need 6.5 or higher, or passing score at the VCU English Language Program Comprehension Test. So, and next spring. So I'm going to talk next about the School of Nursing classes. There's 3 that you could choose 2 out of. And Allison will talk to you about 6 credits that come from a plethora of courses that Da Vinci has. They are innovative. They have very creative courses. We're taking courses from in the nursing side, from the leadership program, the master's. If you have going for your master's in nursing in the leadership program, this would just add 2 courses from the Da Vinci and you can get your certificate, but you still have to enroll in this. So there's 3 courses. Let's see, this spring is the 517 course, and that's the organizational science implication course. So you look at individual and group thinking in this course. It examines organizations as a whole. It's a good thing to know about the healthcare organizations that you'll need to work with in order to get progress done for any products or processes that you're thinking about. Then there is the 517, then comes the 603 course. The 603 course is interesting. It has an improvement in science and outcomes management. So its emphasis is really on quality and safety. They teach you techniques, tools in analyzing organizations and clinical processes. And it's a root cause analysis. So you're really digging deep into medical errors. And knowing that, you may be able to develop or brainstorm ideas on how to fix those things. We're always looking for that. Measuring outcomes is quite important to see if what you've developed is actually effective. And then you also learn about regulations and how to monitor safety in that course. And then the other course is the 515 Holistic Leadership course and Concepts. It more talks about the person themselves. You learn your organization, societal, where you fit in the healthcare field, and leadership concepts. Emphasizes communication and decision-making skills, not just your own, but you understand and can identify other people. There's quite an overlap between some of these courses in leadership, just with a little bit different lens to healthcare and to innovation side. So it's important to learn both languages and the way both systems work. And now I'm leaving you with Allison. Can you talk about the courses that the Da Vinci program has?
This looks like a lot of courses, but there's quite a few you'll see that are repetitive here. And one new one that we've just recently added. And learning that other language, I got to say, is super important. I just gave a presentation in the School of Nursing on prototyping. I think I can't remember if it was a week or two ago.
Yeah,
but I tell you what, I speak the language of product very well, but Ingrid, I need to learn more about the nursing side of things.
I'll help you next time.
Truly merge this together. So maybe
Okay.
I need to take this.
We'll do it together.
Yes, I know some of the language, but some of it is just a little outside of my purview. So I love to learn, so why not? Okay, so looking at the Da Vinci Center's options for courses, there are quite a few. I will go over some of the elective options that we offer. Those vary between semesters, and so we just try to keep it open as we can to, again, meet you where you are and help you develop the skills or the knowledge sets that you really need in order to move forward with what it is that you're developing. So looking at spring, since that's our next semester, we have a few options. In 0610 just converted to being a full-on course. It used to be a topics course that is $691. But its popularity has led it to be this a full-on course that's offered as an elective through the Master Product Innovation Program. It is a 3-credit course. It's innovation, design thinking, and change management. So like Ingrid was saying, in terms of there being some overlap, the change management, I would definitely see that as a big part of it. This course comes with multiple internationally recognized certifications in design thinking. It's taught by someone who actively works in design thinking in industry and helps other people who are developing products, services, processes, really learn how to be user-focused in that space. How do we use this to innovate? And it is the foundation of all Da Vinci programs. Everything we do is based on design thinking, human-centered design. Those terms are commonly used interchangeably, but you know, it's meant to really give that foundation and that I guess mindset of how you need to think when you're approaching something. This is part of the Da Vinci magic, in that people who come through Da Vinci, both in this program and our other programs, just really say, you know, if you want to do anything, Da Vinci is everything. And I love that phrase so much. And Alan would probably shoot me for saying that out loud, but it's wonderful to see that, because it's about a mindset. It's about being able to approach many different kinds of problems from a specific perspective, so that you can create things that are attainable and valuable and that people will like. So that course really gets into that innovation, design thinking, and change management side of things in the industry of product. That one's a great one. The In0651, which you see the second one listed under spring 2023 here, is the Master of Product Innovation project. So this is actually the first half of the capstone for the Master of Product Innovation program. And this course is really meant for students who already have an established idea, maybe have already started prototyping, but you've identified the problem and really tried to validate whether or not that problem is something that a lot of humans have. This particular course is one of the most challenging in the MPI program. It is 6 credits, so you can take just one class and it will completely cover all of your credits that you need. I got to say, the students who have taken this course in the past have taken far beyond 6 credits in the innovation program, and you are also welcome to do that. But if you already have an idea for a product, let's talk about it. Let's see if this course is right for you and if this is something that you're really interested in taking, because it goes from idea to working towards commercialization. So you're bringing that idea and you're working on that validation, understanding what the market is, learning to prototype, test with your users, and really trying to figure out the best way to move it forward. So that course is a bit challenging, but we can figure out whether or not you're right for that one through a little advising. The In0691 courses, these are topics courses that we offer in product innovation. In spring of 2023, I'm not entirely certain yet exactly which ones we're going to be offering, whether they link directly to product innovation that would be helpful for a healthcare professional is unclear at this moment. Depends, I guess, on how you view that. This fall, we're offering a course on, creating a Shift magazine to create a visual representation and advertisement for all of the students who are displaying their projects and testing their products inside the Shift retail lab. Maybe that kind of marketing, the art side of that would become very valuable to you as a person who's looking to explore product. You can make that decision for yourself. There's also another one called Designing Your Life, where you apply design thinking principles to your own life and your goals and what you want to accomplish in years to come. And that I know has been very helpful, but just depending, again, 6 credits. If you only want to take those 6 credits, which ones do you want to be a part of?
That's a good point. You could take more than 6 credits.
Absolutely. Yeah. And sometimes it makes sense to do that. I think, the folks that are already coming into this program with PhDs and master's programs really see the value in taking some of these topics. And I'm going to go into a little bit more detail in the next slide on those topics courses and how they apply to product. But there's just so many options. And we do a lot of 1 credit courses so that people can kind of pick and choose and put things together. So you're not necessarily having to pay the tuition for a full 3 credit class to learn more about intellectual property, those kinds of things. So, trying to make it as modular as we possibly can. That's why Da Vinci ends up with all of these other classes. But that 610 class that I just spoke about is offered every single semester, fall, spring, and summer. So that one is always available to take. The moving down to summer of 2023, looking at INNO 600. This is called Integrative Design Studio, but what it actually is a study abroad program. And next year we will be taking students to Porto, Portugal, for the European Innovation Academy. And this is a place where 65 different nationalities come together all in one place. You can either bring an idea or jump on a team with someone else who has an idea. You form a team of 5 and you work that idea towards commercialization all the way through the process in just 3 weeks. You're pitching to venture capitalists at the end of this thing. You're being mentored by people from Google and Twitter and Ducati and Amazon, name like a big company, and they have mentors there. They do, give talks and lectures in the mornings. You can learn in depth about all different kinds of things, social media marketing, lots of things about intellectual property, but it is meant to be the entire process of product development and entrepreneurship crammed into 3 weeks. And that sounds like a lot, but it really does give the breadth of knowledge of everything it takes to be able to launch a product if you're interested in being an entrepreneur. It's an incredible experience to work on a cross-disciplinary team and one, just study abroad and be in a perpetual state of problem solving. Because you probably don't speak Portuguese. I'm just going to guess most people speak English there, but there's a lot to understand how just to buy groceries in the grocery store or, how to work within the social norm. So again, it's a wonderful experience and feel free to come to Portugal with me. I welcome you. We've already talked about 610. We've already talked about some of those topics in product innovation. So moving on into fall of 2023, we get into INNO 502, which is business principles for product innovation. This is an opportunity to be taught by an international business consultant and a serial entrepreneur. We have 2 people who've been doing this work for a very long time. Jeff Hammond and Sonali Shetty co-teach that course. If you're taking it fully online, it may just be one of them, but the in-person course is both of them. Sonali comes from a background in biomedical engineering. She's launched several tech products and companies. And Jeff Hammond is part of Allison Partners. He is an international business consultant who's been teaching in the MPI program since its inception. Both incredible human beings. They make one heck of a team, and they can help you learn everything that you need to know to understand, to pitch to investors if you need to understand what the value of your product is. Really distilling down how do you actually get a product to market? How do you analyze all of the funding you're actually going to need in order to get this thing into production, to be able to get it in front of people, advertise it, all of the things, the manual labor you have to have in the background, your profit and loss sheet, your return on investment, all that kind of stuff. It happens in that course, and you do it through applied projects that are being worked on in the very last course that's there called INNO 590. This is a course that I teach, and it's called Da Vinci Project. Ingrid is a mentor for this course commonly. And that the INO 590 course, it says in parentheses with permission. And that is because I'm going out basically a year in advance and talking to the Dominion Energies, the VCU dental schools, the CarMaxes, the Capital Ones, and I'm finding these problems. And if I know that I have medical students that are coming into this or people who are interested in the medical field, I can then solicit medical projects for you to get some real world experience in terms of product innovation and working on that cross-disciplinary team and developing products for the medical industry. If I don't know in advance, like at least few months in advance, it can be really difficult for us to kind of nail those projects down in enough time for this to be a really valuable experience for everyone involved, but in a way that I'm not rushing to go find a project because I have 20 students who all of a sudden want to sign up as the fall semester is starting. So that's why we say with permission. It's not officially listed under the certificate, but we are more than happy to welcome students from really any major into this program, because that's what the Master Product Innovation Program is. We have arts, we have business, we have engineering, we have humanities and sciences, history, we have medical students too. I have two PhDs two MDs that are coming into the program this spring. So lots of opportunities in terms of that. I'll go ahead and move on to the other elective courses because I could talk forever about these things. So I'll give you a little bit of context. We've already talked about INO 610 a little bit. These other courses that you kind of see in the middle, those are courses that we offer generally for 1 week, 1 graduate credit in the summer. Now, mind you, 1 week, 2.5 weeks, however it works out, you're in class for about 4 hours a day. So it's a lot, but again, always after 5 p.m., accommodate working professionals. I know that doesn't necessarily accommodate the medical profession, but hopefully it's a little easier than having it be 8 o'clock in the morning. So looking at user experience, user interface. UX UI is everywhere. It's in every digital product you've ever experienced. And user experience can be everything from when you walk into a restaurant or your experience of pulling into the parking lot and all the way through the end of your meal when you get your check. That entire experience can be spelled out very clearly for a medical practice or process. How do you actually move through the space? How does your user experience that of being in a doctor's office or seeing a nurse practitioner or going from, hey, I broke my leg in a car accident through PT? All of that can be considered user experience. So it doesn't have to be a digital interface by any means. There's lots of ways to prototype these physical experiences and services. Intellectual property for startups, gotta say, I think a lot of people see this title and think that it would probably be a relatively uninteresting class if they don't think that they already have an invention. But I gotta tell you, it's not. It's one of the best ones that we teach. This is taught by An Liu, who is a partner at Nixon Peabody, which is one of the top intellectual property firms in the world. It's been around for like 180 years. And you seriously go through like 3 real life client projects in this class. So you learn all about patents and trademarks and copyrights. But what does it mean when someone violates your trademark, your copyright, or your patent? How do you litigate that? How do you create the argument to make sure that you're the person who actually gets to maintain your intellectual property? Or, in terms of trademarks, how do you, create a competitive advertisement there where you're not infringing on your competitor's trademarks? What does copyright even look like? What does that even mean? How do you use that to your benefit? And then it's called intellectual property for startups because the point of this is how do you monetize any intellectual property that you have? So if you're just a company that creates a bunch of patents for the sake of making patents and saying, look, I have 100 shiny patents or 300 shiny patents. What are you doing with those if they're not making money for your company? They're just expensive wallpaper at that point. Mm-hmm. So this is how do you actually use your intellectual property to make money? To start a startup, because that is equity in your business to have intellectual property, all kinds of things. And I got to say, as lawyers teaching this thing is the most entertaining course that I think I have been through. That's saying a great deal. So highly recommend that one. There's also things like Scrum Product Owner Certification, Scrum Master Certification. That is a really big thing. To have CSM or CSPO after your name can be a really powerful thing if you're looking to work in the product world. And that is also 1 week in the summer. Let's see, user-based research, really diving down. What are those methods that we can use to get to the heart of why people buy things or why procurement might go for, one type of medication versus another, or, one type of gauze versus another, speaking very high level, obviously without my medical language here. But this is an opportunity to really understand how people think through their own problems in their jobs, or how they might solve them with a product. And how do you get to the core of that, right? Because a lot of people say one thing and do another. So it's exploring all of that. And then the couple of things that I mentioned earlier in terms of like shift branding, or, you know, creating a magazine. So talking about social media and marketing and all kinds of messaging in terms of that, and then designing your life. If you don't know where you want to go, it's a really great class to take. It's only 1 credit, and it really helps you figure out what your personal goals are. We offer lots of classes like this. I think we're going to be offering a few more in the spring that have different topics. I have welcomed all of my faculty to just propose new topic ideas and see if we can get some interest in it, and see if it's something that students are really maybe interested in, or maybe we're finding a gap that we don't have in our other programs and that we need to assign. It's part of our innovation, part of our experimental processes there. All right. Also, there's a link down there at the end of this slide that you can go to the Da Vinci website and see all of the classes, undergrad or grad. So if you're still an undergrad, we still have classes that are open to everyone, and any 500 level class that we offer there, like Designing Your Life, can be taken by both a undergrad or a grad student. So we get to mingle those 2 different groups. All right. All right, tuition, if you hadn't heard enough of my voice yet. Tuition, we are looking at, really it's variable. It depends on what programs you belong to. So if you are only in this certificate, if you apply and are interviewed and are accepted to the certificate, you pay School of Nursing credit, or sorry, School of Nursing tuition. This is not reflective of fees by any means, but in-state is $723 per credit hour, out-of-state is $486 or $1486. If you're part of the Master of Product Innovation program, doing the certificate costs you nothing beyond what you would pay for the MPI. The MPI needs 6 credits of elective courses, and we have accepted the School of Nursing courses as our electives, so those things overlap nicely. If you are a master's student from an MBA, from the College of Education, or really anywhere else, the tuition you pay is related to your master's program. So if you are in a master's program with elevated tuition, that is the standard tuition rate you will pay to participate in the certificate. But I will say this, if you are in another master's program and you're interested to figure out how these courses might align or potentially overlap with your program, reach out to us, let us know. I'm happy to reach out to other directors. I know Ingrid would be too, to just kind of discuss, like, is there a place that we can make sure that you're meeting the requirements for the primary program that you're a part of and still fulfilling the requirements for this particular certificate. But yes, so the tuition rate varies depending on which program you are a part of. Let's see. All right, next one. Ingrid, do you want, is this one's mine, isn't it?
That one's yours.
Okay, well, I'll just keep on talking then.
Yeah,
all right, so financial aid. Financial aid is a pretty interesting subject when it comes to just doing a graduate certificate. There are some benefits. So if you're just coming out of undergrad, or you've been out of undergrad for a while, know that being a graduate student, like you would in the certificate, means you only have to be enrolled in 5 credits in order to receive federal funding. That is a really important part. You know, when you're in undergrad, you have to be in 12 credits in order to receive federal funding, and that can be pretty daunting. You do not have to be full-time in this program, which is considered 9 credits for a graduate level program. But you can qualify for federal financial aid. In terms of scholarships, both the School of Nursing and the Da Vinci Center do offer scholarships. These tend to be offered to students who are enrolled full-time. So just giving you a heads up that, you know, if you are part of another program or part of one of our programs, nursing or MPI, that there will be more scholarships that are available to you through that. I also suggest look at VCU Business Services, look at the National Scholarship Office. There are lots of really unique scholarships out there, and not all of them are for full-time students. So you might find something that really fits you well in the life that you've lived, the experiences that you've had that maybe some other students don't qualify for, and you can be that awardee. Looking at graduate assistantships. Graduate assistantships in the Da Vinci Center are reserved for students who are in the Master of Product Innovation program. But if you are a part-time student or belong to another program, I highly recommend looking at the VCU Handshake site. there are lots of departments that either don't have enough graduate students or are looking for a graduate student to be able to fulfill some hours. And again, most of the time, these are full-time students, but you can get tuition support. Sometimes there's a stipend that goes along with it. So there are a lot of opportunities out there. I've seen my MPI students go get these graduate assistantships in other programs as well and help fund their program. Ingrid, do you know if the School of Nursing does graduate assistantships or not?
I'm not sure about graduate assistantships, but they do have TAs.
Oh, teaching assistantships. Excellent.
Right.
Yes.
So if you're interested in that, and also it changes every single year. So the School of Nursing did really well with raising monies for scholarships for students. So it's worth checking on the site to see like which people or which scholarships or awards are given to different people of different interests sometimes. So, and also the Langston Center.
Yes.
Website you can look at also. So there's
Always
plenty
worth
of places under the School of Nursing that you can look for scholarships. And again, it's changing all the time, so I can't give you just one answer.
Yeah, there's never one answer.
Quite a few.
There's always new ones. We're getting new ones at Da Vinci,
which is a good thing. It's a very good thing.
Absolutely. That's my goal. I would love to be able to make our programs free for people in the future.
Yeah.
That's a aggressive, that's a ambitious goal, I should say, but maybe
It's a good one. It's a good one.
All right.
So what you need to submit by November 1st, which is the spring application, is the application form. And there is a fee, $70. Sometimes the fee waivers are available. You need to contact Allison for this. Is it available this time too? Yeah. Okay, so contact Allison for that. We need 3 references or letters of recommendation from professional and or academic people. Only names and email addresses are required at the time of the application. Eventually, we'd like those letters to come in. We need at least 2 of those before we do the interview process. Am I right on that, Allison?
You are correct. And once you enter the information into the system, it will ping your references to send us those letters. You won't be responsible for collecting those letters. Yeah.
Which is really nice, so you don't feel like you're hounding somebody. A statement of purpose is required. We want to know more about you and what do you think this program will give to you. A resume stating relevant work experience would be very nice to have. It could be a CV also. And then official transcripts from all schools that you've attended, I believe that's a VCU policy. You could, so if you went to 5 different schools, we want to see it. You can submit unofficial transcripts in the beginning for us to reference before your interview. And then we know that that takes time to get the official transcripts. But to be fully accepted as an applicant, we need to have those papers.
Yeah, absolutely. I do want to add on to this. Really, this stuff is meant to get to know who you are as a person. We do a holistic review of all students who come in. So if you don't have that 3.0 GPA, but you started a business while you were an undergrad, and we look at the whole thing. So a transcript can tell a lot more. GPA is really easy to drop and really hard to bring up, much like a credit score. And so really, traditional students aren't always necessarily the best fit, but they really can be. But when we get non-traditional and traditional students together, that's where a lot of magic happens in this program. There's a lot of applied opportunities and problem solving, and we can use the best of everybody's brains. So, taking a GRE or GMAT doesn't tell us much about you other than you can take a test. But what we need to see is that you have a real interest and a passion there. So yeah, that those 3 letters of reference, that statement of intent or statement of purpose, and your interview will be the primary factors that we're looking at, just to give you a heads up on what it is that we're officially looking at to understand who you are. But we are definitely happy to hear from students who maybe don't feel like they fit into the traditional model of academia.
There's nothing traditional about this program.
Thank you. Yes.
On purpose. It was deliberate. So it's very creative, hands-on. I have to tell you, it's fun. You learn a lot. You're not sitting still for a moment.
That is for certain. And I think it's a good idea to call out the differences there, between the two sets of courses. So
Mhm.
looking at, I know I'll speak for Da Vinci, through Da Vinci, we don't take tests, we take risks. Everything that we do is applied. You never have to take an exam the entire time you are taking any of our courses. You are tested on the problems that you are solving, your documentation of those problems, your pitches that you come up with as you develop solutions and those kinds of things, your teamwork, how your teammates you and respect you, those kinds of things are how our evaluation goes through. But I know that it's a little bit different than the School of Nursing. Ingrid, care to say a few words?
Yeah, the first element you said was we don't take tests. You have to remember, though, in the healthcare system, it is very kind of rigid. We do take
Gotta
tests
be
because
for
it's
safety.
knowledge-based. You got to follow the rules. Otherwise, I mean, lives are at stake. So it's a merge of two types of learning. It's in the space of leadership. We have more room to be creative than you would at bedside nursing. Got to get that. I mean, you don't want to put it in the wrong place, kind of thing. But once you have that knowledge, then you get to be creative. I was a leader in the healthcare system as well, and you do get to solve problems, and you're really at the heart of where the problems are, and you have a lot of knowledge. So it's a good place to be as well. But we, by nature, and I think you all want us to be a little more rigid.
Yes.
You want to think
I think we
inside
need
the
to.
box.
Failure means two very different things in these atmospheres, right? In turn,
Yes.
if we fail creating some prototypes, we learn from
No,
them, we move
baby.
forward.
But right.
Fail in the medical field.
Yeah, we don't put people back together with duct tape, and where you might put your prototype back together with duct tape. So
Right, exactly. We can't put people back together with prototype or with
right, but there's a respect between the two, and there's
Absolutely.
checks. We check and make sure that we're not straying too far off.
Yeah, there's a time for both models of thinking.
Yes.
If you're learning about regulations and safety, you need to know those things. So then testing what might be safe, I guess, that you might experience on the.
You also learn about the law. You learn about Virginia law as well, which may be different than neighboring states, which I found out moving from Delaware to here it is different. So you learn about that too. It's just quite fascinating. And both of us can talk about this all night. If you have any questions, reach out to us, and here's our contact information, and we will get back to you.
Yeah, happy to answer any questions that you have. Given it's like we're entering the third week of classes, it might take us a couple days, but again, happy to have conversations, one-on-one conversations, set up meetings, or just answer things via email. You can reach out to us here via our individual websites. Our people will get the messages to us however you choose to find us. But by all means, we are very happy to talk to you and excited to hear from future students for this program.
Yeah, let's solve the problems of the healthcare system.
Oh my goodness, and it's ripe with problems, right? Like everything.
Yeah. Well, we create
things
all the time.
Yes, well, I hope we get to solve some problems together in the future, and everyone have a lovely evening.